Welcome to the Sarah Finkelstein Show, where the next 10 minutes can change your life. Also on Spotify, SoundCloud, and iHeartRadio. Here's Sarah.
Hi. We are in the annual enrollment period right now, and I wanted to share with you important changes to Medicare that you need to be aware of. So, for those of you who are on Medicare, or those of you who will be approaching Medicare shortly, whether in the next few months or sometime next year, there are costs. Unfortunately, Medicare is not free. People often say to me, gee, I've worked all these years, I've paid into the system, it ought to be free. Unfortunately, not. So let's go over the costs. So Part A is the hospital insurance, and Medicare Part B is pretty much, I like to summarize it as anything that happens outside of the hospital, your doctor visits, your outpatient procedures, your lab work, your diagnostic tests, physical therapy, all of that stuff is under Medicare Part B as in boy. And everybody pays a premium for Medicare Part B. Typically, from year to year, those premiums and deductibles increase. So let's go over that so that you could be well prepared. The Medicare Part B monthly premium for next year, starting January 2024, is going up from $164.90 to $174.70. This is what most people pay for their Medicare Part B premiums. But as I'm going to be covering shortly and sharing with you, some people pay more than that. There's also a Part B annual deductible for those people that are on original Medicare, and that is increasing from $226 in 2023 to $240 in 2024. Not too much more, just a few dollars here and there. But very importantly is what other costs are under original Medicare. If you are on a Medicare Advantage plan, which is Medicare Part C, these costs that we're going to be going over do not affect you because your Medicare Advantage plan replaces original Medicare, but you still have to pay your Part B premiums. So for those of you who are on original Medicare, you can go to any Medicare provider anywhere in the country. That means any doctor, any specialist, and any hospital that accepts Medicare. Now, do you have to pay a premium for Part A? Remember, Part A covers hospitalization, skilled nursing facility, and hospice care. So if you have paid into the system during your working years through payroll deductions, and you've paid in for at least 40 quarters, which is 10 years, your Part A premium is free. You do not pay anything on a monthly basis for Part A. However, if you are 65 or older and you haven't paid into the system for the 40 quarters, if you paid in for 30 quarters or more, but not quite 40, your monthly premium for Part A is $278. And if you paid in for less than 30 quarters, then your monthly premium for Part A is $505. So it does pay to get those quarters in. Even if you're working part-time, you still get your quarters in. So if you get the 40 quarters, that's good. You won't have to pay anything on a monthly basis for Part A. However, there are other costs attached to Medicare Part A. So for example, when you go into the hospital, and again, we're talking about original Medicare only, When you go into the hospital and you're admitted, you do have a deductible. And that deductible in 2023 is $1,600, and that's going up to $1,632. And then if you're in the hospital for a long period of time, for example, from days 61 to 90, you have a daily copay of $408 in 2024. That went up a few dollars. And also for days 91 to 150, that copay, daily copay, is $816, up from $800. And also skilled nursing facility. So the first 20 days of skilled nursing facility are covered by Medicare. But if you need to be there beyond day 20, you do have a daily copay of $204 per day for days 21 to 100. So for those of you that are on original Medicare, I do certainly hope that you have a Medicare supplement plan to cover these expenses and avoid these high medical costs. Let's talk about the Part B monthly premium, and that is based on income. So most people pay that new premium of $174.70 per month, and if you're already collecting Social Security, it's automatically deducted from your Social Security check. But some people make more money than those that pay only $174.70 per month. So what you pay for your Medicare Part B premium is always based on your modified adjusted gross income from the prior 2 years. So in 2024, it'll be based on your modified adjusted gross income from 2022. And let me go over that breakdown with you. So if you're a married couple filing jointly and your modified adjusted gross income is under $206,000, you need not worry about paying extra. But if your modified adjusted gross income was between 206 and 258,000, then you will be paying $244.60 for your Medicare Part B, and that's for each of you. If your modified adjusted gross income in 2022 was between 258,000 and 322,000, then your Medicare Part B monthly premium will be $349.40. Again, if your modified adjusted gross income was between 322,000 and 386,000, then your Part B monthly premium jumps up to $454.20. Moving along, if your modified adjusted gross income was between 386,000 and 750,000, then your Medicare Part B premium is $559 per month. And lastly, if your income was above, your modified adjusted gross income again, was above 750,000, then your Part B premium is $594 per month. And if you're subject to IRMA, which is what this is, it's called Income Related Monthly Adjustment Amount, you would also be subject to extra premiums for your Medicare Part D, your drug plan. So these are some reasons why you should be saving on a regular basis for these kinds of potential expenses. One thing to be aware of that has not changed with Medicare is that Medicare does not cover custodial care for long-term care. So when we talk about extended healthcare costs in retirement, we're referring to long-term care. Did you know that 70% of people over 65 will need long-term care at some point and for a certain amount of time? Yet only less than 4% of Americans are actually planning for this tremendous probability and expense. Another reason to be saving money on a regular basis for your financial future. And by the way, when is the best time to start planning for long-term care? Well, first of all, when you're still healthy. And secondly, before your next birthday, because the longer you wait, the older you get, the more expensive your long-term care premiums will be. So I always talk to clients not just about Medicare, but very importantly is the long-term care. Because if you're paying attention, you probably are seeing a lot of these assisted living communities cropping up. And by the way, if you would like to get some more information or the numbers that I went over, if you'd like me to send it to you so you have it on paper, just let me know, reach out. I'll be happy to send that to you. So those are the changes for Medicare in 2024. And of course, if you're on a Medicare Advantage plan, now is the time up until December 7th where you can explore other Medicare Advantage plans for 2024 if you're not happy with your existing Medicare Advantage plan. And for those of you who are on a standalone drug plan, now is also the time for you to shop around for a drug plan for 2024, because sometimes your premiums can jump up significantly just staying on the same drug plan. So good luck, and any questions you have, feel free to reach out. And thank you to TRC Voiceovers for the fine work that they do for us.
Knowledge is power, but only when you implement what you've learned to your own benefit. Tune in next time for even more powerful tips on the Sarah Finkelstein Show.